The reason that this is important is because communities like Dhek Bhal and the South Asian community are marginalised. They're often left out of healthcare research. It matters that we make sure that our participants, so the people taking part in our research, are from as wide a range of people as we can possibly get. This is because if we don't do that, how will we possibly know that that treatment, that new treatment that we're testing, that intervention, will work out there in the real world when it's rolled out in the NHS?
So it's very important, this kind of research, because we are hoping people will benefit in future, although we might not be able to, but other next generation will be able to benefit from this research. And that's what we're hoping. That's why we thought it's very important to take a part in this research.
I think it's very important to be involved in healthcare research. If you're not aware of it, are you supposed to get involved in it?
It's absolutely important because I was recently reading a research paper, the participation of the ethnic minorities, because I think it's 14% of the UK population is diverse and ethnic minorities, and every opportunity must be made available to them to understand in their own languages and express in their own languages if they have to. And it is going to be very effective both for the researchers as well as the participants.
I'm sure there are so many organizations that do more research around so many things, but they need to come out to groups like us and all the other groups as well, and they get feedback from the people, and then they can add those information in their research. Because this, most of the time information is like in English, or nowadays it's all like online. And us a lot, like we don't go on so much, we don't feel comfortable using computer so much like our generation. So it gets very difficult for us to get those informations. So that's why there is like a barrier, there's a language barrier, we don't take part in it. And then researchers, maybe they think, oh, these Asians, ethnic minority, they don't want to get involved, they don't want to take a part in it, so they ignore us. So that's how I feel.
I wonder, has she been asked to be involved in research before at all?
She wouldn't have been unless it was through me, because, you know, who's going to know about her? Who's going to reach out to her? I know, you know, you're working with Dhek Bhal, and clearly as a Dhek Bhal client, they know she's a marginalised, they know she's isolated at home with all these conditions because they provide the service. But most people wouldn't know about her, wouldn't know, you know, that she existed.
Well, if we don't get involved, then that's where we will see the gaps in services, you know. And when you engage with research, then people will come to know what your needs are. And then these researchers will go back and then they will look at policies, you know, they'll devise policy, and then the policy will then inform services. All our services are different, you know, don't think that we are from the minority community, that our needs are the same. Even from the South Asian community, there's a lot of diversity in terms of language, religion, culture.
Like if somebody said to me, would you like to do it? I would love to do it because it helps other people after us, like for our generation, for the next generation.